Taking care of your health after 60 doesn't have to be complicated. With the right information, you can reduce risks, feel stronger, and support your heart naturally. Let's walk through a few simple insights that could make a big difference in your life. Have you ever opened your medicine cabinet, looked at those little bottles lined up in a row, and thought, these are keeping me alive? What if I told you that some of those very pills, the ones millions of older adults take every single day, have been quietly linked to an increased risk of heart attack and stroke? And here's the hard truth. Most people taking them have no idea. If you're over 55, if you take medication for pain, sleep, anxiety, blood pressure, or inflammation, this could directly affect you, not someday, now. Today I'm going to walk you through 5 commonly prescribed pills that cardiologists are increasingly concerned about, especially in adults over 60. You'll learn why these medications can stress your heart and blood vessels, who is most vulnerable, what warning signs to watch for, and most importantly, what safer, smarter alternatives you can discuss and implement. Some of these may surprise you, some may already be sitting on your nightstand. My name is Dr. Ethan Parker. I've spent over 3 decades treating heart disease in adults just like you. Grandparents, retirees, former athletes, teachers, business owners, good people who did their best to stay healthy and still ended up in my office after a preventable cardiac event. And over the years I noticed a pattern. Many of them were taking medications that, while helpful for one condition, were silently increasing strain on their cardiovascular system. Not because they were careless, not because their doctors were negligent, but because medicine is complex. And sometimes risks are underestimated, especially in older bodies. As we age, our kidneys filter differently, our arteries stiffen, our blood becomes more prone to clotting. Our hearts don't tolerate stress the same way they did at 40. A medication that's generally safe at 45 can behave very differently at 75. So today, let's talk about what you deserve to know. Let's start with one of the most common culprits, pain relievers that aren't as harmless as they seem. You wake up with stiff knees, your lower back aches, your shoulder doesn't move the way it used to, so you reach for something like ibuprofen, naproxen, or diclofenac. These are NSAIDs, non-steroidal anti-inflammatory drugs. They're everywhere, over the counter, easy, familiar, but here's what most people don't realize. NSAIDs don't just reduce pain, they also affect how your blood vessels function. They can cause fluid retention, they can raise blood pressure, and they can increase the likelihood of blood clot formation, especially in older adults. Multiple large-scale studies have shown that certain NSAIDs are associated with a higher risk of heart attack and stroke, particularly when used regularly or at higher doses. Why? Because they interfere with prostaglandins, chemicals in your body that regulate inflammation but also help maintain healthy blood flow and protect the lining of blood vessels. When that balance shifts, blood pressure creeps up, arteries constrict, platelets become stickier. Imagine Mr. Harris, 72 years old, active, walks daily. He starts taking naproxen twice a day for chronic knee arthritis. Within months, his blood pressure rises by 10 points. He doesn't notice. He feels fine. Until one afternoon, he experiences chest tightness during a walk. Was the painkiller the sole cause? Probably not. But did it contribute to increased cardiovascular strain? Very likely. Now, I'm not saying never take NSAIDs, but daily long-term use in adults over 60 needs careful evaluation. If you need pain relief frequently, consider these strategies. Use the lowest effective dose for the shortest duration possible. Explore physical therapy to strengthen joints and reduce inflammation naturally. Try topical anti-inflammatory gels instead of oral pills. They have less systemic absorption. Incorporate gentle anti-inflammatory habits. Walking, omega-3 rich foods, weight management. Your heart should not be collateral damage for joint pain. Now let's move to something even more surprising. Certain sleep medications. Sleep becomes harder as we age. You wake up at 2 a.m., you stare at the ceiling. You start counting regrets instead of sheep. So your doctor prescribes something to help you fall asleep. Maybe a benzodiazepine like diazepam or a Z drug like zolpidem. They help at first, but here's the concern. These medications can depress the central nervous system. They can lower blood pressure too much at night. They can cause irregular breathing patterns. And in some studies, long-term use has been associated with increased cardiovascular events. Why would a sleep pill affect the heart? Because your heart and brain are deeply connected. These drugs can alter autonomic nervous system balance, the system that regulates heart rate, blood pressure, and vascular tone. In older adults, this balance is already more fragile. Add a sedative that slows everything down, and you may increase the risk of falls, nighttime oxygen drops, arrhythmias, and even stroke. Mrs. Delgado, 78, started taking a sleep aid after her husband passed. She felt groggy in the mornings. One night she got up to use the bathroom, felt dizzy and fell. A fractured hip, hospitalization, reduced mobility, a cascade of complications. Sedatives don't just affect sleep, they affect stability, circulation, and brain oxygenation. Better options. Prioritize sleep hygiene, dark room, cool temperature, no screens an hour before bed. Magnesium glycinate under supervision can help some people relax naturally. Cognitive behavioral therapy for insomnia has shown long-term success without drug side effects. Sometimes the safest pill is no pill. Now let's talk about something many heart patients are shocked to hear. Certain decongestants and cold medications. You catch a cold, your sinuses are blocked. You grab a decongestant containing pseudoephedrine or phenylphrine. You want to breathe again. But these medications work by constricting blood vessels. That's how they reduce nasal swelling. The problem, they don't only constrict vessels in your nose, they constrict arteries throughout your body. Blood pressure rises, heart rate increases. For someone with stiff arteries, plaque buildup, or borderline hypertension, that temporary spike can trigger something serious. I've seen patients with well-controlled blood pressure experience dangerous elevations after taking over-the-counter cold remedies. They thought it's just a cold pill, but the cardiovascular system doesn't care what aisle it came from. If you have heart disease, high blood pressure, or are over 65, avoid systemic decongestants. Instead, use saline nasal sprays. Try steam inhalation. Use a humidifier. Stick to antihistamines that don't raise blood pressure. Sometimes the simplest remedies are the safest. Now here's one that may be controversial. Certain hormone therapies, hormone replacement therapy, especially estrogen with or without progesterone, has helped many women manage menopausal symptoms. But large trials have shown that in certain age groups, especially women who start hormone therapy many years after menopause, there may be an increased risk of stroke and blood clots. Why? Because estrogen influences clotting factors. It can make blood slightly more prone to coagulation. In younger women near the onset of menopause, the risk profile may be different. But in women over 60 or more than 10 years post-menopause, the cardiovascular risk increases. Timing matters, dosage matters, delivery method matters. Transdermal patches may carry lower clot risk compared to oral forms. If you're on hormone therapy and over 65, it's worth re-evaluating whether the benefits still outweigh the risks. And finally, certain stimulant medications. This includes some medications prescribed for attention issues, fatigue, or even weight loss. Stimulants increase heart rate, they elevate blood pressure, they increase sympathetic nervous system activity. Your fight or flight response. In a 30-year-old with healthy arteries, that may be tolerated. In a 75-year-old with coronary plaque, that's a different story. Even modest increases in heart rate and blood pressure can increase oxygen demand on the heart. If supply can't keep up, chest pain or heart attack can occur. Now, let's clear up a few myths. Myth number 1. If it's prescribed, it's completely safe. No medication is risk-free. Safety depends on age, dose, duration, and your unique physiology. Myth number 2. Over-the-counter means harmless. Absolutely not. Many OTC drugs are powerful pharmacologic agents. Myth number 3. I've taken it for years, so I'm fine. Risk accumulates. The body changes. What was safe at 60 may not be safe at 75. So what can you do starting today? First, review every medication you take, prescription and over-the-counter. Write them down. Second, identify which ones are daily versus occasional. Third, ask, is this still necessary? Is there a lower dose? Is there a safer alternative? Fourth, monitor your blood pressure regularly at home. Fifth, prioritize lifestyle foundations that reduce the need for extra medications, anti-inflammatory diet, daily movement, stress reduction, consistent sleep schedule, weight management. Your heart is remarkably resilient, but it doesn't like surprises. It doesn't like chronic pressure spikes. It doesn't like sticky blood. It doesn't like excess fluid overload. And it certainly doesn't like unnecessary strain from medications that weren't reevaluated. Because this isn't about fear. It's about understanding how your body changes after 60 and how medications interact differently with that new physiology. Let's go deeper. Why aging changes the way pills affect your heart. At 40, your arteries are generally more elastic. They expand easily with each heartbeat. At 70, they're stiffer. That stiffness means higher baseline pressure inside the vessels. Now imagine adding a medication that slightly increases blood pressure, or causes fluid retention, or increases clotting tendency. At 40, the system compensates. At 75, the margin for error is thinner. Kidney function also declines gradually with age, even in healthy adults, and your kidneys are responsible for clearing many medications from your bloodstream. If a drug lingers longer than intended, its cardiovascular effects can become amplified. There's another factor people rarely talk about, polypharmacy. That simply means taking multiple medications at once. The average adult over 65 takes 4 to 8 prescription medications daily. Each one might be appropriate on its own, but together they can interact in ways that increase heart rate, alter electrolytes, raise blood pressure, or promote clotting. And often no single pill is blamed. It's the combination. Let me give you an example. Mr. Johnson, 74, he takes a blood pressure medication, an NSAID for arthritis, a sleep aid at night, and a decongestant during allergy season. Individually, each was prescribed for a reason. Together they create slight fluid retention from the NSAID, periodic blood pressure spikes from the decongestant, nighttime drops in blood pressure from the sleep medication. His cardiovascular system is constantly adjusting, compensating, straining. One hot summer day, he becomes dehydrated. His blood thickens slightly, blood pressure fluctuates, and suddenly he experiences a transient ischemic attack, a min-stroke. Was it one pill? No, it was cumulative stress, and that's what I want you to understand. The elderly heart doesn't fail suddenly. It usually fails under layered strain. Let's talk about another category that often flies under the radar. Certain acid reflux medications, proton pump inhibitors. Drugs like omeprazole and esomeprazole are widely used for GERD and heartburn. They're effective, but long-term use has been associated in some studies with potential increased cardiovascular risk, particularly in people who already have heart disease. The mechanism isn't fully settled, but there are theories. One involves nitric oxide, a molecule that helps your blood vessels relax. Some research suggests PPIs may interfere with nitric oxide pathways, reducing vascular flexibility. Another issue is magnesium depletion. Low magnesium levels can trigger irregular heart rhythms. Now I want to be careful here. For many people, PPIs are appropriate and necessary, especially if there's a history of ulcers or severe esophagitis. But if you've been taking one daily for 10 years just in case, it may be worth re-evaluating whether lifestyle changes could reduce your need. Weight reduction, smaller evening meals, avoiding late-night eating, elevating the head of the bed. Sometimes the solution isn't another pill, it's a shifted habit. Now let's address a medication category that often surprises people. Certain diabetes medications. Diabetes itself dramatically increases the risk of heart attack and stroke. So controlling blood sugar is essential. But not all diabetes medications have the same cardiovascular profile. Some older medications were found to increase fluid retention or raise heart failure risk in susceptible patients. Others, however, have been shown to significantly reduce cardiovascular events. The key is this: not all drugs within the same category behave the same way. If you have diabetes and heart disease or risk factors for it, your medication choice matters more than you may realize. The good news: modern cardiology and endocrinology now prioritize cardiovascular protective medications when possible. But that only works if the conversation happens. You should know what you're taking and why. Now I want to shift gears and talk about warning signs, because your body often whispers before it screams. Subtle signs. A medication may be stressing your heart, new swelling in your ankles, sudden weight gain over a few days, especially 2 to 5 pounds, unexplained shortness of breath when climbing stairs, more frequent headaches, heart palpitations, dizziness when standing up, worsening blood pressure readings. These are not things to ignore, especially if they appeared after starting or increasing a medication. I once had a patient who noticed mild ankle swelling after starting a new anti-inflammatory. She assumed it was just aging. It wasn't. Her blood pressure had risen 15 points. The fluid retention was subtle but significant. We adjusted her regimen. Swelling resolved. Pressure stabilized. Small symptoms matter. Now let's address a question many people are thinking. If these medications carry risks, why are they still prescribed? That's a fair question, because medicine is about balancing risk versus benefit. If someone has severe inflammatory arthritis and cannot function without NSAIDs, the benefit may outweigh the cardiovascular risk, especially with careful monitoring. If someone has debilitating insomnia, short-term sleep medication may be appropriate. The issue isn't that these drugs are bad, it's that risk changes with age, duration, dosage, and combination, and reassessment is often neglected. When was the last time your entire medication list was reviewed as a whole? Not just refilled, reviewed. That review alone can reduce cardiovascular risk significantly. Now, let's debunk two more common beliefs. I don't have heart disease, so this doesn't apply to me. And actually it does. Many first heart attacks happen in people who didn't know they had heart disease. Plaque builds silently for decades. Medication-induced stress can destabilize vulnerable plaque, even in people without prior diagnosis. Second myth, my numbers are fine so I'm protected. Blood pressure 128/78 looks good, but if a decongestant spikes it to 160 for several hours repeatedly, that intermittent stress still matters. The cardiovascular system remembers cumulative strain. Now I want to give you something practical. A medication safety audit you can do this week. Step 1. Gather every medication you take. Prescription, over-the-counter, supplements, put them on the table. Step 2. Write down why you take it, how long you've been taking it, who prescribed it. Step 3. Identify which ones raise blood pressure, which may increase bleeding or clotting risk, which cause fluid retention. You may not know the answers immediately, but the process forces awareness. Step 4. Track your blood pressure for 7 consecutive days, morning and evening. Write it down, notice patterns. Step 5. Pay attention to symptoms after taking certain medications. Do you feel flushed? Does your heart race? Do you feel elated? Data empowers you. Now let's zoom out emotionally for a moment. Why does this matter so much? Because after 60, your priorities shift. You're not chasing career milestones. You're protecting independence, mobility, time with grandchildren, travel, mental clarity. One preventable stroke can change everything. One heart attack can limit the next decade of your life. And sometimes prevention isn't about a dramatic surgery or expensive procedure. It's about thoughtful medication management. It's about removing unnecessary strain. I want you to imagine something 10 years from now. You're walking confidently, stable, clear-headed, no cane, no oxygen tank, no walker. That future isn't guaranteed, but it's influenced by the decisions you make now, including what goes into your body daily. Your heart beats about 100,000 times per day. It doesn't get a vacation. It doesn't get to skip a shift. The least we can do is not make its job harder than necessary. Now I'm curious, have you ever noticed your blood pressure rising after taking a cold medicine? Let's talk about blood thinners for a moment. These medications reduce stroke risk in conditions like atrial fibrillation. They're life-saving, but combining them with NSAIDs or certain supplements can significantly increase bleeding risk, including bleeding in the brain. The danger isn't the blood thinner alone, it's the interaction polypharmacy again, layer upon layer. Now I want to ask you something. How many different doctors prescribe medications for you? Primary care, cardiologist, orthopedist, endocrinologist, pulmonologist, each focused on their specialty. But who's looking at the entire puzzle? This is where you become essential. You are the central coordinator of your health. No one knows your full medication list better than you should. Let's pause here for something important. There's a psychological trap many adults over 60 fall into. I've been taking it for years. If it was dangerous, something would have happened already. But cardiovascular disease is cumulative. Plaque doesn't form overnight. Arteries don't stiffen in a week. Small increases in blood pressure over years can silently accelerate damage. It's not about dramatic side effects, it's about long-term strain. And here's something empowering. Small reductions in strain can produce big benefits. Lowering systolic blood pressure by just 5 to 10 points can significantly reduce stroke risk. Reducing chronic inflammation can stabilize plaque. Eliminating unnecessary fluid retention can decrease heart workload. You don't need perfection, you need optimization. Now let's address another medication category that often gets overlooked: certain migraine medications. Some older migraine drugs constrict blood vessels. That's how they relieve headache pain. But if you have coronary artery disease, even mild undiagnosed plaque, vasoconstriction can be risky. It's not common, but it's real. Again, context matters. The same drug can be appropriate in one person and risky in another, which brings us to something critical: individual risk assessment. Two people can take the exact same medication. One experiences no issue, the other develops complications. Why? Genetics, arterial health, kidney function, hydration status, electrolyte balance, existing plaque, lifestyle. There is no universal reaction. That's why blanket assumptions are dangerous. Now let's zoom into something practical again. If you are over 60, these 5 questions can dramatically reduce your cardiovascular risk. 1. Does this medication raise blood pressure? 2. Does it cause fluid retention? 3. Does it increase clotting or bleeding risk? 4. Does it affect heart rhythm? 5. Is it still necessary at my current age and condition? That's it. 5 questions. Simple, powerful. Now let's talk about the emotional side for a minute. I've sat with patients after strokes. I've spoken to spouses after heart attacks. The most common sentence I hear: "I wish we had known." Not, "I wish we had a miracle drug." Not, "I wish we had a cutting-edge surgery." "I wish we had known." Knowledge isn't about fear, it's about options. When you understand risk, you can adjust course before disaster strikes. Now here's something encouraging. Many cardiovascular risks are reversible. Arteries can become more flexible with lifestyle change. Blood pressure can improve, inflammation can decrease, even plaque can stabilize. But that only happens when we remove unnecessary contributors. Let's reinforce the practical action plan this week. Review your medications, monitor blood pressure daily, hydrate consistently, reduce excess sodium, walk at least 20 minutes per day, prioritize sleep without over-reliance on sedatives. Ask about dose reductions where appropriate. Small steps, consistent steps. Now let me ask you something directly. Do you know your average blood pressure? Not your last reading, your average. Do you know your resting heart rate? Do you know your kidney function numbers? These aren't trivia questions. They're the dashboard indicators of your cardiovascular engine. You wouldn't drive across the country without checking your fuel gauge. Don't navigate your 70s blindly either. And here's something I want you to remember. Medications are tools, not guarantees, not shields. Tools. Used wisely, they protect you. Used without reassessment, they can add unintended stress. The goal is balance, precision, awareness, and partnership. You deserve a heart that supports your life, not limits it. So tonight, when you open that pill organizer, pause for a moment, look at each capsule, and ask yourself, is this still serving me, or is it time to have a conversation? Because prevention at 60 is easier than recovery at 75. And the heart you protect today is the one that carries you tomorrow. Now tell me in the comments, how many medications are you currently taking daily? You might be surprised how common your situation is. If this conversation has been helpful, share it with someone you care about. A spouse, a sibling, a friend from church. You never know whose heart you might help protect. And in our next discussion, I'm going to reveal the specific blood pressure numbers that cardiologists quietly consider danger zones for adults over 65, even when they appear normal. That's a conversation you won't want to miss. Stay proactive, stay informed, and take care of that